Welcome to a breast health update, or a must for the bust. All right, my name is Dr. Sara Wood. As I was introduced, I'm a naturopathic physician, practice just outside of Portland, Oregon. Actually, let me a couple of things out here before we get started. Sorry about the delay. So I just want to start out with introducing the breast. I think we're all familiar with breasts are one of the most recognizable symbols of womanhood and of motherhood and of femininity. They serve many purposes, come in all shapes and sizes, and function from attracting the opposite sex to breastfeeding. We can all agree that they're pretty important and popular. Many women will risk their health and certainly empty their bank accounts, trying just in the effort to have bigger and better breasts. In fact, breast augmentation surgery is now the #1 most popular cosmetic surgery in the country. The problems that women have with their breasts are not just cosmetic, however. Fibrocystic breast changes are incredibly prevalent, formerly known as fibrocystic breast disease. Now it's officially called changes, partly due to that prevalence. Approximately 50% or more of premenopausal women experience symptoms of fibrocystic breast changes, including pain, breast tenderness, nipple discharge, and an increased risk of breast cancer, which we're going to discuss today. A little word about breast cancer. Breast cancer is the most common cancer affecting women. Approximately 1 in 8 women will currently develop breast cancer in her lifetime. Nearly 200,000 American women were diagnosed last year, and approximately 40,000 women died of breast cancer. These are pretty alarming statistics. The point here today is certainly not to scare or we don't want to approach this with a fear tactic. There's also 170,000 deaths every year from hospital error. I mean, the death rate is not the point. What I really want to do here is focus on empowerment and prevention. There's no need for women to just suffer in fear, afraid, and fearful that they're going to get breast cancer. There are many precursors to breast cancer that can be treated. Some of the ones we're going to cover today are estrogen dominance, iodine deficiency, and low vitamin D levels. Quick word on hormones. Fibrocystic breast changes are most common in premenopausal women, and they change with hormonal cycle. They're also reasonably common in women who are on hormone replacement therapy in some cases. And breast cancer is also heavily influenced by hormone levels, so we're going to talk a little bit about hormones today. Estrogen dominance is and this will come up again later, but is a term that was coined by the late John Lee. It refers to the overall influence of estrogen on tissues. Estrogen is a proliferative hormone. It stimulates growth, and especially when it's not balanced by an acceptable amount of progesterone level. Breast tenderness and fibrocystic breast changes are 2 of the most common symptoms of estrogen dominance. Just a quick review of cancer, and I think this is important as we start to talk about mechanisms towards the end here, or towards the end of the presentation. Cancer, as we all know, occurs when a group of cells or a cell grows uncontrollably or fails to differentiate properly. And mutations that cause mutations in cell development can be caused by environmental factors. Certainly genetic components play a role, and sometimes can just be random. Every living organism has genetic mutations that go on all the time. We have natural defenses that help to combat this, including processes that repair DNA, and then, of course, promote apoptosis or programmed cell death if the problem can't be fixed. Breast cancer is a term we use to describe actually what's a number of different diseases. Ductal carcinoma is the name of cancer that arises from the milk ducts in the breast. Lobular carcinoma, when the cancer arises from the milk-producing lobules. And then sarcoma, which is the rarest form, comes from when the cancer arises from a connective tissue, muscle, fat, and blood vessels, etc. Upon biopsy, a more specific diagnosis can be made based on the histological properties of the cells in question. A pathologist will often give a stage or a grade to the cancer and gives you a little more specific information. Stage refers to how far the cancer spread beyond its original place of origin. If it has not spread, then it's deemed non-invasive. This also may be labeled as stage 0 or called in situ. Ductal carcinoma in situ, or DCIS, is the most common form of breast cancer. Approximately 1 in 5 new breast cancer cases. If the cancer has spread beyond its original place, then it's deemed invasive and may be given a labeled as stage 1 through 4. Excuse me. Grade refers to not how far the cancer spread, but how much the cells differ from their original, the cells that they originate from. Grades 1 through 3 are used with breast cancer. The pathology report, you'll also potentially get information about receptors. Hormone receptors that are present in cancer cells merely mean that that cell will respond to those hormones. Does not necessarily mean that the hormone that hormone will cause proliferation of those cells. And we're definitely going to talk about that a little bit more. Breast cancer cells are often estrogen receptor positive, progesterone receptor positive, or may have receptors for HER2, which is a growth-promoting protein. Some malignancies have multiple copies of the gene that codes for this growth-promoting protein. You may have heard of cancers that are called triple negative, meaning that they have none of these. They neither have the hormone receptors or the HER2. Triple negative cancers are generally given a worse prognosis, partly because a lot of the treatment plans, a lot of the treatment that we use with breast cancer rely on these hormone receptors. So I want to talk a little bit about risk. I mentioned 1 in 8 women. That's pretty alarming. So, what can we do? Who's more likely to be in that 1 out of 8, I suppose? 3 big risk factors are going to be gender, age, and heredity. Breast cancer, as you may have guessed, more common in women than it is in men, about 100 times more common. Although men can get breast cancer, approximately 1% of new breast cancer cases occur in men. That's equivalent of about 2,000 a year. So it's something to kind of keep in the back of your mind and think about. Approximately 2/3 of invasive breast cancer is found in women over the age of 55. And then heredity. So 5 to 10% of new breast cancers may be caused by an inherited genetic mutation or occur in women who have a family history of breast cancer. One said genetic mutation that we often test for is the BRCA mutation. BRCA1 and 2 are genes that code for tumor suppressor proteins, and there are various mutations in these proteins that can increase the risk of cancer. Now this gene is named for breast cancer. That's where the BRCA comes from. Also increases the risk of several other cancers, including cervical, uterine, gallbladder, melanoma, quite a list. So it's important to remember in general. About 60% of women with a BRCA1 and 2 mutation will develop breast cancer. That's pretty alarming, I suppose. And a lot of these women elect to have a prophylactic mastectomy. I kind of like to look at it as the glass is 40% full, maybe, and that means 40% of these women are not going to get breast cancer. So it's not a absolute, doom when they are given that diagnosis.